Hello, everyone. I'll be speaking about how to perform systematic review, which is a very scholarly synthesis of evidence on a very clearly presented topic using critical methods so that you can assess the research on any particular topic. And why do we need this is because there are too many publications coming out every day, almost 8,000 publications per day. And all these are not equally well designed or interpreted. So, what we need is a study of studies so that we synthesize the best possible evidence for questions with ambiguity and eventually help practice guidelines, especially in clinical practice. And if you look at the level of evidence itself, the systematic reviews and meta-analysis occupy the topmost place because of the amount of rigorous methodology we use to do these reviews, which are very strictly peer reviewed. And sometimes when we pull in a lot of these studies, it creates a large sample size. And sometimes we can have the best of the studies, the best of the level of studies to do systematic reviews. Even at level one, we can have 1A and 1B, where only randomized clinical trials are just only them used for systematic reviews, or we use only cohort studies, which is 2A and 2B, or low quality RCTs itself. And if you put up all the clinical trials together, these are called as interventional systematic reviews. If you just add only cross-sectional cohort studies, it becomes more of observational study review. And if you have diagnostic text accuracy studies, these are called diagnostic systematic reviews. Well, what is meta-analysis? A lot of people confuse between systematic review and meta-analysis. Meta-analysis is one step ahead where we put in quantitative evidence. A lot of data is put up. If you just look at this picture of Mount Everest here, this is just additional of all the data that where is Mount Everest, how is it, and all those things. But if somebody puts in this kind of a data where the height is measured, the amount of meters, the amount of feet, and things like that, so this is what is the difference between just a systematic review and having meta-analysis, where pooling the data to give a one effect size with a larger power, the large sample size, that's what is becomes a meta-analysis. So even the systematic review follows the same thought process of any kind of a study where we first check for research question, what exactly we want to find, what exactly we want to synthesize in terms of evidence. We look at the eligibility criteria and start searching the literature and see whether we do have enough of these. If I want to say I want to just put in the RCTs of all the RCTs available between comparing between volar plating and K-wire fixation distal radius fractures. So I need to see the feasibility of it and see how many RCTs have come out, and then we check for this these quality of the studies. So the screening and quality assessment is done, and then we do the final analysis. So it's always a team work. You can't just do it alone. At least three people would be required for individually assessing these all these studies, the title, screening, abstract, and full text. And any resolution of the differences is required by a third person who usually is a senior author here. And the data synthesis and the reporting by the entire team is what happens during systematic review. So we already know how to formulate a research question for an article. Same way we do the same thing for the meta-analysis and systematic review also. Along with that, we also ask what is the type of question we are looking at. Is it the diagnostic or a prognostic or a therapeutic kind of an answer I want? And of course, the type of studies which I already mentioned. And based on these, we come out with primary and secondary outcomes. And we also look at the eligibility criteria, as I said. Here, this is an example of closed suctional surgical wound drainage after hip fracture surgery with drainage and without drainage. And say they included all the randomized control studies which compared this. So that is the first eligibility criteria. Then they looked at the outcome measures here, including wound infection, wound hematoma, and complications. So this is how we come out with the eligibility criteria, and then you start excluding this. So this eligibility criteria is uploaded to your research question also, and also the type of the studies you would be including them. Both you'll that's how your protocol builds up here. And again, another example here is spinning versus volar locking plate in unstable distal radius fractures here. So again, the search strategy according to the guidelines is given. What type of studies was used in the randomized studies, including non-randomized two-arm studies, retrospective studies, and of these fractures inclusion also required studies reported data of at least one outcome of interest, that is any of these things, because they were doing meta-analysis for either a grip strength or a pinch strength. So they excluded all these case reports, editorials, and one-arm studies, letters, and all those. So very important to have the eligibility criteria. And a very important way to search for these articles would be your keywords. Relevant keywords are very, very important. The same study included distal, external fixation, fractures, KYs, locking plates, internal fixation, meta-analysis, WARF, and radius. But a lot of times they might not actually throw up all the articles. The best way to do is in a more scientific manner using the medical subject headings through your PubMed, where all these keywords can be tried and see what gives you the best type of keywords. Also, there might be different terminologies, like a physiotherapy can be called as physical therapy, spellings can be different, hyphens can be used for some words like non-surgical, and or phrase searching. So putting it in these inverted commas, carpal tunnel syndrome searches it as a single phrase now. There are also some softwares which can mine these keywords, and sometimes you can use connectors like and or are, and that can catch up more and more of these studies. So you have huge amount of databases where you can search for all these studies, and you need to mention that in your methodology what databases you used. And once you've done that, you check the article, identified it, the author one and author two will review the abstract and also go for full text screening and independently review these two together. And finally, if there's any disagreement, as I said earlier, consensus is by the third reviewer or the senior author, and finally include them in the study. This is the Prisma flow chart, which basically is how you start off documenting how you have done these all the screening of your articles, how many you got initially, how many you had to exclude, how many duplicate records were there. After abstract, how many you excluded. After full text, how many excluded. And finally, what was the inclusion number of articles we included, and what was the reasons also why they were excluded can also be put into this. At the same time, parallelly, you're supposed to do this important step of registering your systematic review. And this is the website through the NIHR. This is called the Prospero website, where you need to go in. This is also one of the ways to actually look at what the systematic reviews are being done all over the world. And you can check whether what you thought as an idea of doing systematic is that somebody is already doing it, or when was it being done, or if somebody is registered 2 years before, there's no point in you doing it again. An updated systematic review is at least 5 years should have elapsed for you to do the same thing again, because by then enough data would have accumulated in the world for you to do a new systematic review. So Prospero website is one such thing where you can go in and register, and it tells you what all it accepts, what type of studies it accepts, and it's a good place to start off your systematic reviews. And once you've done that, you need to check the quality of the study which you have included. And this is called as a quality assessment or critical appraisal. And there are a lot of criteria, a lot of tools which are available. Cochrane gives this risk of bias assessment for randomized study. This is the second version, the latest version of that. And you can use this, which gives you these kind of data charts where you have to enter this all the characteristics of each of the randomized studies. It tells you the study characters, how the randomization process was done. All these, if you include, finally you end up with this kind of a scoring system where all the studies you've included shows what is the quality of the study, whether it's low risk or high risk, and then tells people that majority of these studies were good quality studies or majority were not so good. And then you extract the relevant data for your research question based on the protocol, what all you wanted, your primary and secondary outcomes. You synthesize the data. If you want to do meta-analysis, you have to do the statistical analysis for that. And finally, write the discussion, summarize, and interpret the evidence to answer your research question. And then write about the clinical implications for practice or policies. Meta-analysis, as I said, is when you have a lot of data there. So in this particular same study, which I mentioned earlier, they've talked about scores of dash, scores of visual analog scale, patient related risk evaluation scores, range of motion, and complication incidence. So all these have a lot of data points. And so when you have a lot of studies with this, you can pull in the data and say overall range of motion of this in an volar locking plate was this out of all these studies. And that is plotted in this called as a forest plot, where it is an amalgam. It just overall shows all the studies included and what is the trend, what is the association of these studies in terms of the overall interpretation of the included studies. Well, after that, you need to report your systematic review in a structured format. And this is called as a PRISMA, or the preferred reporting items for systematic review and meta-analysis. If you go to this Equator network, you will see these guidelines for all types of studies. Even a case report has a guideline. And if you write your case report as per this, it is easily accepted. So same way systematic review has this PRISMA guidelines, which has about 27 checklist here. So Prisma checklist, Prisma flow diagram, which I showed you earlier, Prisma statement, all these have to be written in your methodology there. So this checklist has 27 questions here. It talks about at each level, how is your title, how the abstract, how is the introduction done, how the methodology needs to be done, how the data should be extracted, how you interpret your results, how to write the discussion. Everything is written. So if you go through this, you know how to exactly do the systematic review. So, in summary, a scholarly synthesis of evidence is what we are looking at. And this is a study of all the studies which you choose. And it is at the topmost part of the EBM because it is very rigorous. The methodology is very rigorous. And if you do it in the right way, you will get a very, very kind of good evidence. And as long as you adhere to the guidelines, it gives the best evidence as possible. Thank you so much.